make sure everybody understands that these webinars are for information only. This is not intended to replace any specific medical advice that anybody might have. And if you do have any specific medical concerns, we do ask, of course, that you present that to your care provider specifically, rather than, asking us again specific medical questions during a webinar. My name is Eric Percy Fine. I have been a physical therapist for a little over 20 years now. I'm an Arizona native, and I do try to get outdoors, as you can see in that picture, as much as I possibly can. I love being a part of nature, get my sunlight as much as I possibly can. Things I like to do that include hiking, cycling, running, and really also I really do like my work. I love the opportunity to get to share knowledge and experiences with people through Forte. Yeah, there you go. So tonight we are talking about the benefits of exercise, specifically strength and endurance, but we also have another little piece at the end that we call being more neat. And so we'll talk about that as we get there as well. The benefits of exercise, most people have probably heard things over the years that's been established for many years by many different researchers regarding particularly strength training, which is also sometimes called resistance training, as well as endurance training. And honestly, in my time involved with exercise and activity, people have often been on the side of, oh, I should do more strength training, or, oh, I should do primarily resistance training. And, they don't necessarily always marry the two together. And for example, when I was young, guys would go to the gym and work out, and girls would do aerobic type exercise. But thankfully, even by the time I entered into college, and from that point forward, I started to learn more and more about how to bring those two together and make a much more cohesive and even complementary mix of the two. And now, of course, in most sports settings, it is encouraged to do a combination of strength and endurance, and then they also will pepper in things like flexibility and balance. And then the other stuff that's coming up that's newer information, and that we're going to talk a little bit about toward the end of this presentation, is just how beneficial just day-to-day common activity can be for you. There's a lot more newer research around that, what we call NEAT activity. And again, we'll talk about that in a little while. So what is strength training? Well, simply put, again, this is anything that you do that might build your strength. A lot of people think they need to go to a gym, have weights, and do a lot of weightlifting to get stronger. And that's true. You can certainly do it that way. But you can also do a lot of strength training without any equipment whatsoever. Again, a lot of times people think that strength training is about getting bigger, bigger muscles, and we call that hypertrophy. I'll probably say that word a few different times during the presentation. And hypertrophy or larger muscles, again, is certainly a goal that can go along with strength training, but it doesn't necessarily have to be. It can also be doing things like calisthenics, and you can see, from the pictures, these ladies are not big, buff, working out kind of ladies, but I would guarantee they're all strong. They're doing body weight resistance exercises, which again is just meaning that we use our body for our resistance at varied speeds, varied angles, varied numbers of repetitions, and it's all based on our individual abilities and our individual goals. And we'll talk about goals as we go along too. Those are really the key to whatever it is that you do for an exercise program. And so again, regardless of what you're doing as far as strength training is concerned, it's all about time under tension, meaning how much we make our muscles work and under how much strain. Body weight exercises are beneficial for a variety of reasons. The biggest two, of course, are you don't need to have any specific equipment and you can do them anywhere. And so the nice thing about being able to just use our body for exercise, for resistance, is it kind of takes away some of the excuses of vacations and holidays, and letting people know that, you can continue to do things that are good for you, even when, you're away from your gym in a normal case. Because all, again, you really need is just your own body. And for many of us during COVID in particular, just to make this a little bit more recently relevant, this is what we had to work with. Gyms shut down. Getting in exercise equipment, even through Amazon, was difficult for a lot of people. I can't tell you how many people I heard complain about it. It was difficult to get, and it was more expensive than normal as well. But again, body weight exercises are something that even beyond COVID, we can continue to do for ourselves that can make us, again, stronger and healthier over time. Most yoga and balance activities that people could think of would also be included in body weight activities. And again, there are a variety of different things that you can do and that you can even find examples of online through YouTube and things like that, and really never touch a piece of exercise equipment. And it's nice, but but in addition to yoga and other balance activities that could include Tai Chi, for example, lunges, squats, push-ups, most of the core strength exercises that people do are all considered body weight exercises. And in the exercise classes that we offer through Forte, the vast majority of what we do with the clients that we work with there are body weight exercises. We do incorporate some light resistance for different things as well, based on the person's capabilities. But our primary goal is for people not to have much equipment. They can just be able to continue to do things on their own over time. But again, let's get back to some basics. With strength training, one of the first things that people ask is about reps and sets, right? And this might be intuitive to some people, but reps are repetitions and sets are groups of repetitions. Okay. And so in the bigger scheme of things, though, what we really want to know is how many reps and how many sets do we do? And that, again, depends on your goals. You're going to hear me say that depends on your goals a few different times tonight. But it's true. The point is your goals will then determine how you need to exercise or how you decide to exercise. And you can see from the chart on the slide that it talks about a 1 RM in the middle. That's a 1 rep max. And we can talk a little bit later if you want to about what a 1 rep max is. But the key to pay attention to is the first and the third columns there. If you want a light to moderate resistance level, you'll probably end up doing more repetitions. If you want a heavier resistance model, you're going to probably do less repetitions. And again, it depends on what your goals are. If you want to be strong but lean, we would typically talk about working with higher repetitions and lower resistance. If you're looking to get bigger and bulkier, then we would talk about higher weights and less repetitions. So again, it always comes down to what your goals are. But I'll tell you that you can get amazingly strong without ever having to do really high intensity, high resistance workouts. And again, as a physical therapist, when somebody says to me, how much do I do? I say, let's address this, from where you are coming from. Start with what is manageable to you, and then we can kind of increase things from there. But for most beginning exercisers, whether it's a brand new thing for you, you've never exercised before, or you're restarting after a period of time away from exercise, we usually start with lower repetitions, lower resistance, and talk about doing probably 1 to 2 sets in a day. And again, those don't have to be consecutive sets. You don't have to, finish one and then do the other. You can do them throughout the day, and we'll talk a little bit more about the benefits of that in just a moment. But I'm stumbling here a little, but the point is never push yourself so hard with your exercise routine, especially in the beginning, that you're getting any sharp or stabbing kind of pain. Sharp pain is a sign that you're probably pushing yourself a little too hard. We'll talk again a little bit more about that. But the focus really, regardless of where you're starting, is that it should meet your goals and it should be what works for you, not what a personal trainer or even a physical therapist is telling you. It needs to make sure that it matches up with your goals and your capabilities now. I kind of alluded to this a couple of different times. You can break up your activities throughout the day. And what that does is a few different things. First of all, it creates a little bit less physical stress on your body. When you're doing your repetitions, you can do them all of whatever number of exercises that you're doing, and know that once you're done with that set of repetitions, you could be done for now, and not get yourself overly fatigued, overly sweaty, overly tired, anything along those lines. It also causes less muscle soreness to break things up throughout the day, because you're not doing so much at a single time. You're giving the muscles more of a chance to rest, hence they don't get quite as sore as a result. It also helps you grade the number of repetitions in each set. So while if you know that you're doing 2 sets consecutively, you might be saying to yourself, I need to save some energy, to get through my second set. If you're giving yourself a long enough break, meaning probably anywhere between 2 and 4 hours or longer, you can do more repetitions in each set, and allow yourself to, and not allow yourself to have to worry about what's going to happen at the second set. It also helps you control your form a little bit better. So when people are doing exercise and they get fatigued, they start to compensate. They start to move parts of their body differently than they should, which can lead to injury and strain. And so again, breaking things up throughout the day helps minimize that fatigue that can lead to those compensations and that can lead to those strains. And in addition, for most of us that are sitting a lot throughout our days right now, it helps break up your sitting a little bit more throughout the day. And since there's lots of recent research, again, with the advent of COVID and everybody working remotely and on computers and doing Zoom like we all are right now, that sitting is so bad for us, or potentially very bad for us. Any opportunity to get up and move throughout the day is going to be better for you. So some good basic beginning exercises, and these are more for the upper body, upper extremities, are shown here on the picture. These are by no means the only ones that exist, but these are some good, common, easily reproducible exercises for the upper body. The plank, so that first one on the left, the plank really engages so much of the body as a whole. You can see that he has to stabilize where his head and neck position are. He's working his shoulders. He's stabilizing through his elbows and upper arms. He's keeping his core tight to keep his hips up off of the floor and keep his back from rounding too much. And then, of course, because he's on his toes, he's also stabilizing through his legs all the way down to his feet. But a plank is something that can be modified really easily as well. So you can put yourself on your knees, if being up on your toes is too difficult. You can go at the arm of a couch instead of all the way down onto the floor. And so that angle changes the amount of resistance. You can even go up against a wall. And I do have some people that when they first start doing planks, we do them just against a wall, because that's where they can go at that time. And then we progress down based on their abilities. Triceps dips, work the back of the arms, right? And so again, they are easy to modify. It's a good way that you can use your body weight to really strengthen up the backs of the arms there. As you can see, she's doing it down on her hands and feet on the floor. It's a good controlled position because, she can set her bottom down on the floor. A lot of people will do these off of a bench or a chair, and with the same idea that they can use their legs to really help lift and lower the body if they need to, so they can grade that resistance. But you can even start up higher. You can go with your hands against like a countertop and just allow your elbows to bend just a smidge there and kind of work your way down, just like we talked about with the plank. And then similarly, push-ups. So again, this picture is showing the person on his knees and doing a push-up. You can certainly do a push-up in a full onto the toes position. You can do them on the knees like this gentleman is showing. And much like the plank, you can go to the arm of the chair, arm of the couch. You can go to the countertop like we talked about, and you can certainly do these up against a wall. So they're just, the nice thing is, and that's the point, is you can vary these things to make it tolerable and functional for you. And some good beginning common body weight exercises for the legs and lower extremities really, it would include things like lunges and squats. And you see in the picture there on the lunges that she's going down pretty low, right? She's got her knees bent to almost 90 degrees. And I'll tell you that when I first start people with lunges, we usually talk about like a 5 to 10 degree bend in the knee. And the same thing with a squat. We talk about a 5 to 10 degree bend in the knee. Nothing really low, because I want to make sure that we're not irritating the knee joints. We're not losing balance and putting too much pressure on one leg over the other. We don't want to irritate the ankles. We're watching for flexibility issues. And so while both of these ladies are showing a deeper movement than I would normally encourage to start off with, depending on the person's capabilities, they're both valid exercises. And then I always also tell people whenever we're doing lunges and squats, I have a little rhyme that goes with this, and it's wherever your knee covers your toe, that's as deep as you go. And the point with that is that if your knee is covering up your toe, you look down and you see you can't see your toes anymore. That means you've bent your knee just enough to where if you go further, it increases the potential to put a lot of pressure under your kneecap, which can cause some irritation and potentially damage depending on you. And so we just try to discourage that knee getting out in front of the toe. And ultimately, we work on strengthening up the muscles from the hips into the knees, even all the way down to the ankles, to make that a much more functional movement over time. This third picture, this single leg balance picture, I like to put in balance activities for nearly everybody because there's such a high incidence of falls for people as we age, particularly as we get over the age of about 60 to 65, because that's about when most people are entering into retirement. And as we enter into retirement, we also enter into a decreased activity level for most people. And so we see an increase in falls after that period of time. And so if anybody wants to, you can stand up for just a second and let's just test this single leg balance thing real quick. Okay, so be near something that you can put your hands onto for support if needed. And what I want you to do is put your hands onto the thing first and then lift up one of your feet. I'm lifting up my right foot because I know my balance, I just know my balance is worse on my left, okay? And then see if you can lift your hands off of whatever your support piece is. And see how long it takes before you need to put your hand down. So count to yourself. And ultimately, if you feel like you have to keep touching down or you feel like your foot is wobbling a lot, and you end up having to kind of touch down or stop standing on one foot in under 10 seconds, you may be at a fall risk. And if you have happened to have had a fall in the last year, we would absolutely categorize you as somebody that is at a fall risk. So just keep those couple of things in mind. And it's certainly something that you can use to help improve your balance as well. So I do like people to practice that single leg balance in addition to a variety of other things over time. But again, let's just review. There are a couple of always things to keep in mind. Always avoid sharp pain, right? And we said it before. I'm just saying it again, just to give everybody that reminder. Avoid sharp pain. Sharp pain is a sign that you're pushing yourself too hard for now. And that if you keep doing that, then you could end up leading yourself into a situation where you hurt yourself, you cause a strain, and you may end up seeing somebody like me, a physical therapist, for therapy rather than just for education. And again, that's the goal. We're trying to prevent that. The other thing to keep in mind is that stiffness and soreness is normal. Again, if you haven't exercised ever, or you haven't exercised in a while, when you first start an exercise program, it's very common to experience what we call delayed onset muscle soreness, or DOMS. Usually, the normal course of that delayed onset muscle soreness is it'll last for about 2 to 3 days. And the second day is usually the worst of the three. Or worst of the three. On day one, it's a little sore. On day two, it's pretty darn sore. And on day three, it's kind of like what day one was again. And on day four, you don't feel anything anymore. It is not a sign of damage. It is not a sign of a problem. It's just a sign that you did more with your muscles than they were accustomed to. And really, as we make muscles work, they do have to break down and then rebuild, and then break down and then rebuild. And as you continue with a similar set of exercises, you don't continue to get that delayed onset muscle soreness unless you go really crazy one day and push really hard again, or increase things significantly over what your normal is. Now, if you get too aggressive, even in the beginning, and you do way too much, and you feel that muscle soreness is lasting for more like a week or even up to 2 weeks, that can still be normal. It just means you pushed yourself too aggressively in the beginning, and that you just are going to take a little bit more time for your body to calm down. I will tell you that, and this is true of most potential strains, sprains, and basic injuries, if you aren't getting better within about a 2-week period of time, I would encourage you to seek advice from a medical professional. All right, but you're here because we talked about, the title was, what are the benefits of exercise, right? So some of the obvious benefits, right, of strength training is, hey, we get stronger, right? But just because we get stronger, well, what does that mean? Well, it means that it makes life easier, right? If you're a person that makes a little noise when you get up out of a chair, you make that little grunt groan sound, and it feels like it's a little bit of a struggle sometimes, that will get easier if you do strength training. If you lift the 3 or 4 bags of groceries and you feel like that's a bit of a struggle, bringing them out of your car and into your house, strength training will make that easier for you. And easier just means that you're less likely to get hurt, right? So it improves your ability to perform activity with a decreased chance of injury. It also will help increase your metabolism, right? So we talked earlier about hypertrophy. And so bigger muscles, whether they're lean or bulky, bigger muscles require more energy just to exist, okay? And so what that means is that at rest, they're going to continue to pull energy producing chemicals out of your bloodstream, so sugars and oxygen out of your bloodstream, just to exist, just to be there. They keep your body heat slightly elevated as a result as well. And that increased body heat also requires us then to keep our body cool. And that's the whole metabolic process, is heating and cooling all the time. So bigger muscles require more energy. And then the other thing that we know for sure that's pretty commonly known for a lot of people is that it's really good for your heart, right? So as we work harder, as we push things that are bigger and we do it for more repetitions or for longer periods of time, our heart works a little bit harder, which means our heart is doing the same thing that we're doing when we're doing a biceps curl. It's working a little harder, so it gets stronger as well. And as the heart gets stronger, it gets more efficient in the job that it does. But some of the less known pieces about the benefits of strength training are that, first of all, we use strength training to help improve people's status as far as their function and everything, not just for, because they're a little bit weaker, but even in chronic disease states and new injuries. It doesn't matter, if you go to a physical therapist they're going to do things that kind of help decrease your pain potentially, but their goal is always your function. And the reason behind that is that there's a lot of data that we can see on this slide that talks about how it helps us improve our muscle strength, our endurance, and our ability to produce power. It makes our bones stronger, our muscles stronger, and the tension in our tendons and ligaments more robust. Which again makes us less likely to have injury. It improves the communication between our brain and our muscle tissue, which means it improves our coordination. And certainly it helps regulate hormones within our body that help control like our insulin production. And so it helps control our blood sugar as well. And so there's a lot of really good benefits to resistance training that we always want to make sure we keep in mind. So we are at about the midpoint here. And this is the point where we open things up. If anybody has any questions, I haven't seen any come across. If anybody has any specific, it's fine. If you don't, I'll just go ahead and talk about ones that are commonly asked for me. And so one of the most common things is people want me to review reps and sets. Well, what are we talking about with reps and sets again? And what is a 1 rep max? So let me just tell you, I told you we might talk about it later. A 1 rep max, so everybody knows, is a determination that a lot of personal trainers will do with a person when they first start at a gym. And what they do is they add progressively heavier and heavier weights for the person to push against or lift or whatever, depending on what it is that they're testing, until they get to the point where all they can do is just a single repetition. They can't do any more, and they just have to stop at that point. That's a 1 rep max. What tends to happen is it causes a lot of muscle soreness. And so again, we tend not to go that route with things from a therapeutic point of view. And again, the biggest thing that people want to know again about reps and sets is how many and how often. And I'll tell you, and I'll review this also later, that the Department of Health and Human Services of the United States, and this has actually been kind of shared and repeated throughout the world really, has recognized that at least twice a week, people should be doing resistance training of some kind or strength training of some kind. And so oftentimes we say, okay, well, let's do upper body one day and lower body another day. Only twice a week. And again, it doesn't have to be something that you're doing a whole bunch of repetitions of. You could do a half a dozen exercises for the upper body, a half a dozen exercises for the lower body, on 2 separate days and be just fine. Because again, it depends on what your goals are. So twice a week is what we're talking about. We talk about usually starting with 10 to 15 repetitions. You increase your repetitions first. And when you get to the point where you can do 15 or 20 of them in a row, we say, okay, now let's break it up and do a second set in the day. And we go back down to 10 to 15 repetitions until, again, you can get to that about 20 in a row. And then we can talk about either increasing your resistance or adding another set. And then the other thing that people often ask, well, what if I get bored? How do I know when to change up my program so I don't get bored? And interestingly, there's research on that as well, as you might already have guessed. But the research suggests that most people are happy doing the same set of exercises for up to about 2 months. And at about that 2-month point is when they decide that they need something different. And it doesn't have to be, just so you know, it doesn't have to be a complete switch in the whole set of exercises. So if you were doing push-ups, for example, you could change your push-ups to planks. And if you're doing squats and you weren't doing lunges, you could change your squats into lunges. The goal is to hit the same muscle groups with just a different exercise. And you could just change up one exercise in each group. And that's often enough to keep the person's brain stimulated so they don't feel bored anymore. And there again, about another month to 2 months later, you just change out one thing again and you move right along. Okay, so I am going to move right along, speaking of that, and we're going to talk about endurance training. So endurance training is the thing that I do more than anything else. That's just my personal preference. I just prefer it. I like it better. For my goals in my life, endurance training is the thing that I prefer to do. But in my experience, it's also the thing that people talk to me about first when they're talking about excess weight management. And so we will, like we did with the resistance training, talk about some basics. So one of the first basics is that a lot of people think more is better, right? And to a point that's true, but if anybody ever says to you, go hard or go home or run until you puke or anything along those lines, pay no attention to those statements. It is good to push yourself, but not to the point of complete exhaustion, or certainly not to the point where you make yourself sick. That's just torturous to your body, and it usually is a sign that you're probably pushing yourself into dehydration and a potential for injury. So we really don't encourage that. That's advice that I was given 30 years ago when I was in high school. It's advice that I still hear people given even now. And I just want to tell you, if anybody says that to you, move on and talk to somebody else. Endurance training, like strength training, is again about time under tension. But the biggest difference here is that endurance training is going to affect mostly your heart and your lungs. And the reason is that we usually are doing thousands, literally thousands of repetitions of steps, or of cycling revolutions, or of arm strokes, or anything along those lines, and over extended periods of time. For a lot of people, if you do track your steps on a watch or a device, excuse me a second. Again, you know that we're talking about, hold on a second. We're talking about doing something along the lines of 5,000 to 10,000 steps in a day. And the same thing is true of the number of repetitions you might do on, pedaling rotations on a bike, or if you're doing an aerobics class, or again, swim strokes. But that number of repetitions is why it's so good for your heart and your lungs, is it works those muscles in particular to teach you how to be able to be more active for longer periods of time, hence endurance training. All right. And again, when you are doing endurance activity, we make our heart specifically work harder to push the blood through the body for a longer period of time, right? And so again, we talked about this just a little bit ago about strength training. We are making the heart work harder, right? We're pumping more and for a longer period of time at a higher rate in many cases. And so what it does is it makes the heart stronger over time, and as it gets stronger, it pumps harder, so it becomes more efficient. And what you'll find is that at the same intensity level, your heart will start to not have to work as hard over time. Similarly, the same thing affects our lungs. Our diaphragm in particular, as well as some muscles along our ribs and even up into our neck and shoulders, learn to work more effectively to improve our breathing. And so over time, it becomes more efficient, and so we don't have to work so hard to do the same level of intensity. But in addition to that, we're also boosting our metabolism during the time that we're doing the exercise. And that's one of the first differences between endurance exercise and strength training. Endurance training is really boosting the metabolism during the activity at a much higher rate than it will ever be during strength training, and for a couple of hours afterward. We'll talk a little bit more about that in a minute. Strength training really is boosting it as a residual effect. You're boosting it a little bit during the time that you're doing strength training, but it's really more that muscle bulk that we talked about that keeps your metabolism, your resting metabolism, at a higher level over time. Again, it's why it's good for us to do a little bit of both. And so some people will say, well, but what if I have breathing problems? And I'll tell you that if you have asthma, if you have COPD, if you have any breathing problems, really, you can still do endurance exercises. And we'll explain some different kinds in a little bit. But it does mean that we change how quickly we progress and how aggressively we start. But I'll tell you that I had a couple of breathing related issues, particularly when I was younger, asthma in particular, and I got valley fever. Anybody that's lived in Arizona long enough knows valley fever is actually a fungal infection that affects your lungs, and it makes them less compliant. And so those are both things that I, had treated, and was a definite difficulty for me during high school and college. But as I continue to run and bike and hike, my breathing, over time has gotten more efficient and better. And so just as an example, I can tell you that even with those obstructive and restrictive breathing difficulties, you can still do endurance exercises. I mentioned this a second ago or about a minute ago, but I just want to review it again. Endurance activity boosts your metabolism during the activity and for a couple of hours afterward. And the why on that is because, again, we're increasing the heat within our body. We're utilizing those muscles for extended periods of time. So we have to pull that oxygen, we have to pull that sugar into the system, utilize, all of that. But the metabolism is based on the heat and cooling mechanisms of our body. And so as we heat it up, we've got to cool it down, and we still have to cool down for usually up to a couple of hours following that endurance activity. And I put this other picture on here that talks about metabolic dysfunction because, again, endurance is where a lot of people are talking to me about mostly when they're talking about excess weight management. I would tell you that you should do both endurance and strengthening to more effectively manage it. But because metabolic dysfunction is a component of excess weight, it's just important to understand that we are affecting your metabolism with both endurance and strength training activities. And again, I want to really point out and help everybody understand everyone can do endurance exercises. Walking is the most common kind of endurance exercise that most everybody can do. And mostly because all you really need is a pair of shoes and some clothes, because of course we don't encourage people to go outside undressed, right? But walking for endurance is purposeful walking. This is not window shopping. This is not grocery shopping. This is, I'm out and I'm trying to get to a moderate level of activity. And so that means I can say about 5, maybe 6 words at a time, and then I got to take a breath. And you just kind of keep going like that. So moderate intensity is a higher level of activity than a lot of people probably think. And for some people, walking can even feel at a high intensity. And for other people, it's always a very low intensity. But it's a great place to start. And I'll tell you, one of the greatest things about walking is that you can use walking as your endurance training and have the exact same health benefits as you would if you were running or cycling or swimming or any other type of endurance activity. Walking is just as good for you as any of those other things, and you don't have to worry about the pounding that it puts on your body like running might do for you. And again, some estimates even for the average person are that you are burning about 100 calories per mile that you walk. So that's kind of a nice little number in there. Running is probably the most common form of activity that people usually talk to me about. They're like, oh, I started running so I could lose weight. And that's great, except that, not everybody should just start running. Running is an action and reaction activity. It's something that I usually encourage people to use with guidance, at least if they've never run before, or again, they haven't run in a long time. How strong our muscles are to control the reaction forces at our joints as we hit the ground with up to 7 times our body weight with every landing stroke really makes a big difference. And that's usually why people will end up getting hurt or having problems with running, is because they start before they're ready. And so while I think that running is a fantastic thing and I like running myself, it's something I often will encourage with guidance, but I will tell you that regardless of size, as long as your muscles are strong enough and your joints will tolerate it, anyone can run. And again, all you need are clothes and shoes. Cycling is something that's great for the family. We can all get out and kind of stay together and get on bikes and ride around. We're not pounding our bodies, but it gets a little bit more expensive because everybody has to have a bike. But again, while you do need a bike, and that does cost more than a pair of shoes in many cases, you really just need a bike, preferably a helmet, preferably some protective eyewear, but you don't have to have special clothes. The ladies on the right-hand side do have, some cycling specific clothing. What that helps with is wicking away a lot of the heat because it keeps the clothes close to your body. And so as the wind blows over you, it helps you stay cooler. But again, nothing specifically necessary there. And swimming is fantastic because it is zero impact on your body as far as, you're not pounding joints in any way, but you can strengthen your arms, you can strengthen your legs, you can strengthen your spine, you can strengthen your heart and lungs in the whole process. And so it's really a whole body activity that really doesn't beat you up in any way. So we really do encourage swimming for people that have access, but naturally, if you want to swim, you have to have a pool or access to a lake. And ideally, you can swim so that, right, if you do go underwater, you don't panic and drown. But again, we're supposed to be talking about benefits of exercise. So as a quick review here again, some of the underrated benefits of exercise include it really helps control your anxiety, your stress, your depression. We talked about the functional mobility already. After you get used to exercise, you'll actually find a boost in your energy levels. At first, it makes you feel more tired, I'll guarantee you. Most people will tell me for the first couple of weeks they feel more tired, but as they become more accustomed to it and everything stabilizes, they will actually start to feel more energized. It's an improvement in your overall health. It helps you sleep better. And it also helps you as you go along and you're feeling stronger and you're feeling functional improvements. You just feel better about yourself. So your self-esteem will increase as well. And so we get to the discussions about how often, right? Just like everything else, how often should I do it? And so we often talk about, 30 minutes a day, right? And I'll tell you a little bit more in just a minute, but 30 minutes a day is kind of what we're looking for. And this 3 times 10 equals 30 thing, we all know how to do that math. But what it means is that in a day, you could do 3 different times of 10 minutes of moderate intensity activity and have the same benefit as doing one 30-minute session in the same day. And what that means to you is that you can get the same benefit from breaking things up more often throughout the day, like we talked about earlier. But again, it depends on your goals, right? All of your exercise is always going to depend on your goals. Do you want to get stronger? Do you want to be a competitive person? Or do you just want to have more time where you can functionally interact with your family and just in your own life? So we always look at those goals. We want to always discuss those goals with you as we move along. The American Heart Association, the Department of Health and Human Services, again, they all work together. They talked about, these studies, and they talk about this 150 minutes a week of exercise. So that's where we talk about those 30-minute sessions. And oftentimes we talk about 30 minutes, 5 days a week of moderate intensity activity. But it doesn't have to be 30 minutes. It can be longer. It can be less. If you're working at a higher intensity, it can be even 75 minutes. But we want you to be able to learn, first of all, that you start where you are and you work your way up. So even if you don't get to that 150 minutes in the beginning, that's okay. Meet yourself where you are and work toward it. And the 150 minutes is ultimately just talking about for those really optimal health gains. That's what we want you to work toward. But as you start with activity, all activity is better than no activity. And so your end goal might be 150 minutes of endurance and 2 days a week of strength, like you see here, but that doesn't have to be where you start from, okay? Like this side is saying, we just want you to do some type of activity at least 5 days a week. But if you're, again, starting with 1 or 2 days a week because you're at 0 right now, that's fine. Start where you are and we progress from there. Now, I know I'm running out of time because I've been talking a lot, right? But we just want to talk about this NEAT stuff, and this is relatively quick. NEAT, as you can see, is non-exercise activity thermogenesis. Thermogenesis, again, is the generation of heat, right? So we keep talking about heating and cooling. And again, this is about your metabolism. As you do things throughout the day, all of our activities, even me standing here moving my hands around and just the fact that I'm standing versus sitting, I'm generating more heat in my body than if I were sitting still. And so my body has to do something to clear that out, and that uses energy. And as we use that energy, that's what that thermogenesis piece is, right? And we want to get rid of, we want to cool ourselves down. And so we generate the heat, we cool it down. We generate the heat, we cool it down. That's the job of our metabolism. NEAT activities are anything that we are not doing as a planned exercise. It does not include sleep and it does not include eating. It's literally everything else that you do throughout the day. So if you're going for, if you're walking to work, if you caught the bus and you had to walk, a short distance to work, if you're typing, if you're handwriting, if you're working out in the yard, those are all NEAT activities. And so what oftentimes I will tell people is start with just standing more throughout the day. If you stand versus sit for an hour, you're already going to burn 70 more calories on average. Okay, that's just standing instead of sitting. So sit-stand desks are great for things like that. But then add in these things like taking your dog for a walk instead of just letting the dog run around in the backyard, kneading your own bread dough if you make bread, hand washing your dishes instead of using your dishwasher, and even using a smaller cup of water and having to get up and walk to refill it and come back periodically throughout the day. Making life a little less convenient and a little less efficient is actually a really good way to increase your NEAT activity throughout the day. But all of the fidgeting and things that people do count in there as well. And again, the home runs of everything for tonight are, keep in mind to always make small changes first, right? So we're not jumping right into, high repetitions and high resistance. We're not jumping into 5 days a week of exercise. Add in what works for you. If it's Tai Chi, if it's yoga, if it's strength training, if it's endurance, if it's doing more NEAT activities, increase those things slowly and progressively so that it will be successful for you. Also, your goals always have to be your goals, not somebody else's goals. If you're trying to meet somebody else's goal, you're never going to be successful. So always set your goals for you if you want to have a long-term success. And again, whatever you choose, just start small and build your way up. And if you have questions, Forte can help you answer some of those questions. We can help you with any exercise training if you would like to, but we can also help you through lifestyle management training guidance to help make some of those small changes in your life so that you can be successful and meet your goals. So it's a second opportunity to open up for questions. And again, if nobody has any, that's fine. I will say that most of the time at this point, people are asking again, just verifying. So Tai Chi and yoga count, and absolutely they do. They'll help with balance, strength, endurance, flexibility. They're a really good low intensity way to start with activity. They also help decrease your stress levels and your anxiety levels, just like other endurance activity would. So those are great to include. And again, I like to re-emphasize here how important NEAT activity is for people. Fidget, I'm a pencil tapper, foot tapper, clicker, with my pen in my hand. I'm a person that fidgets throughout the day. Even if I'm sitting and watching TV, I usually have a foot moving around. It drives my wife crazy, but it is what it is. And that's just something that I've always done. But the more that you can incorporate things like that, allow yourself to fidget, make life, like I said, a little less convenient. That's hugely effective in helping increase your metabolism so that, especially if you're looking at trying to control excess weight, that's the word I was looking for, manage excess weight. NEAT activity is a lot more of an impact than the planned exercises that a lot of people do. And again, the math on that is, if we just take, for example, standing versus sitting, if I stand, for say 5 hours of my day at 70 calories, times 5, that's 350 calories in a day that I burned just standing, right? And that doesn't include anything else that I'm doing throughout the day. But the more that I'm up and moving and doing things through my day, I might burn 500 or even 600 calories a day more, just because I made myself move more. And if you take that times, 5 days of the week, if I take my 6 times 5, now I'm at 3,000 calories, right? And that doesn't even include the weekend. And so typically to lose a pound a week, we're talking about burning off about 3,500 calories in a week. And so it really gets person to that goal, to that range more easily just to be more active through our days. So in the end, that's what we have for you tonight. I hope it was informative. I hope it was helpful for people. I would like to say thank you for coming. Thank you for joining us. And then if you have any feedback or any ideas for future classes, again, if you want to send those to us via chat or anything along those lines, we would be happy to get it. It does look like I have one chat here, one question. I just got to thank you. Oh, I appreciate that. Well, thank everybody again. I'll go ahead and let you go for the night, and I hope you all have a wonderful rest of your night.
We here at Forte would like to thank you for watching our video. If you liked it, please give us a thumbs up. If you would like to follow more of the offerings from Forte, please subscribe below. And don't forget to share us with your friends. Enjoy well-being.